Good afternoon, everyone. I invite you all for this session. Though this is not named IC, it was submitted as IC only. So I invite our mentor, teacher, Dr. Mahesh Mugam sir, to be the master for this session, and I invite Dr. Raju to join us, and Dr. Jayaprakash, Dr. Krishnendu. Dr. Vishal will be joining us little late because he'll be like he has a presentation in another hall also, so he'll be joining us late. So though we have planned one 15 minutes session for us to enlighten with the words, Mahesh sir, he said he'll be taking his words after each presentation by us. So I would like to introduce you to this session, what I thought of when I submitted for this session. So like as we all know, some 20-25 years before, it used to be like rare entities and poor prognosis cases. But all these last 2 to 3 decades, having OCT handy and anti-VEGF injections and other injections and microincisional VR surgical techniques, we all know it has improved the perception. And even now, like whenever we attend any retina session, it's about how it presents, what is the difficulty in diagnosis, and how different is your approach for the surgery. But in the end, what the patient is getting, that particular thing is not clearly addressed in many of the publications and presentations. So I thought of this session for that reason. So to analyze the factors that can predict and what actually the publications say, what if you do this, what the patient is actually getting. So that we wanted to look at. As I mentioned, the perspective of general ophthalmologist is that the retinal disorders doesn't have good prognosis, and having a retinal disorder is a end of fruitful life. And the retinologists have this perception of not having encouraging results. I keep hearing people attending cataract surgery session saying that retina doesn't have prognosis. So this kind of perceptions are still there. So most of the presentations will look at how the injections work, how the one injection is different from the other, and like even for RVOs and DMEs and retinal detachments, what kind of different kind of surgical techniques that you approach, and regarding injections. And whenever you see iridomacular degenerations, inherited retinal disorders, like most of the times it is considered as brushed off like poor prognosis. But what are we addressing? Well, we have to address the patient's concerns. So what the patient has to expect from what we are treating. So any patient who walks into your clinic expects that his condition is cured, and he doesn't want to come back to you, and he wants to have least possible visits, and he expects that let him live his life. And the driving and other specific works in life are definitely compromised certain situations. So he wants all those things to be taken care of. So they don't understand. If you say my patients get 6/9, he doesn't understand what is 6/9. What matters for him is his life. So one should address that. So there are certain publications which looked at quality of life, like this particular paper, visual quality of life after macular hole surgery, outcome and predictive factors. So this VFU25 value is something which is considered to analyze the visual function quality. So this is a standardized one which they have used, and they found that preoperative visual acuity and OCT parameters, they do help, and there is definite improvement in visual quality of life in these patients after the macular hole closes and the vision improves. So this is one, though I could not get many VFQ because standardization is not there in most of the publications. This is one more, a large series where they have looked at many etiologies. They found that epiretinal membranes in their study gave the best quality of life scores after the surgery for epiretinal membranes. And certain studies, they found that epiretinal membranes not much of a difference, because that studies, they looked at cases where they were operated at better visual acuity. So those who are having poor visual acuity, they do definitely have a better quality of life after the surgery. So this particular paper enumerated many different etiologies and the visual quality of life. So we are going to look at the prognostic factors in terms of these, like what is in relation to the onset of symptoms or disease and disease parameters and associated pathologies, and what are the efficacy and limitations of treatments and what the complications that happen. So this is what we are going to